Hello everybody, thanks for joining China Book's Q&A with Dr. Kevin Ryan. Kevin is a registered acupuncturist and osteopath with particular interest in the treatment of musculoskeletal dysfunction, pain and neurological disorders comprising fertility, mood disorders, inflammatory arthritis and endocrine disorders. Kevin studied with the now famous Geelong osteopath Thomas Bowen during the final 3 years of Tom's life. Kevin in his 40 plus year of full-time practice with busy clinics in Geelong and Melbourne. Thank you for joining us, Kevin.
Thank you, Trevor, for that introduction, and welcome to all of those looking at this video. I began practice 43 years ago, this coming December, and I was trained as an osteopath, as a natural therapy practitioner or a naturopath, and also in TCM acupuncture. And I practiced in Geelong for the whole of that time, the 43 years. In the last 6 years, I've also been practicing at a clinic in Melbourne. Bowen techniques are a group of techniques, all of which were developed by Tom Bowen, the Geelong osteopath, and they're used for treating a wide range of musculoskeletal conditions. So Tom would treat lower back pain, middle back pain, upper back pain, neck pain, problems with smaller joints such as elbows, knees, ankles, wrists, fingers, toes, jaws, and the individual techniques, when you look at them, they look similar. They look like there's a cross fibre flick that's used on the tissue. It's done with a great deal of finesse, accuracy, and it's done with a gentle approach, so there's no discomfort or pain for the patient. Some of those techniques are lever assisted as well, so the pelvic work, for example, and the shoulder work involves the practitioner using a lever effect with the limb, either the leg or the arm, to achieve a joint, a change at a joint such as the hip or the shoulder. But it looks very gentle, and it looks, for a trained TCM person, they would have absolutely no doubt that what they were looking at was someone who knew acupuncture points, because every single contact point is an acupuncture point. One of the mistakes that they might make is coming along thinking that I was going to try and turn them into osteopaths, but that's not actually the case. What I'm trying to do is to get them to see how really simple, gentle, sort of cross-fibre stretch techniques using well-known acupuncture points, there are very few surprises, when they're done in the right sequence, cause amazing change in the way in which joints function and the way in which the person themselves functions. So the classic thing is that if you think about the back of the upper body, so we're looking at the bladder channel in particular, and the so-called back shoe points, is that some practitioners needle those, and other practitioners probably wish they needled them more often but aren't quite sure how it fits in with their therapy. The thoracic technique that Tom used was totally inner and outer back shoe point related, and it means that when you're performing the treatment, you're getting feedback about, so for example, if you find that there's a particular type of tissue in the upper back shoe area, upper thoracic area, so perhaps around the lung area, then you can expect to find other issues within the lung channel and also within the patient's presentation and symptoms. So it's a two-way event. The thing that brings most people into healthcare, looking for healthcare, is either pain or misery, and they're often linked. And so people in pain are often miserable. You know, it has a big impact on them, and so the kind of pains that can make a person miserable or just cause them problems things like knees, for example. Knees are a very common injury. Ankles are a common injury. Shoulders are common. And then low back pain, neck pain. So when we look at something like neck pain, like for example, I do a lot of work under referral from a neurologist, and that work is to do with migraine and headache and head pain. And so all of those patients, as well as having acupuncture for that, I'll always look at them from a musculoskeletal perspective, because there are neck issues behind a lot of those problems. So that's part of it. Well, Tom Myers wrote a wonderful book a long time ago now called Anatomy Trains, and it is a wonderful way of just looking at the facial connections of the body, so that we can get an idea of why it is. Yeah,
for you.
I have one I prepared earlier. So this book has got terrific descriptions of the interaction of movement across the body and the way in which there are connections. So, for example, when we do in the workshop talk a lot about the knee and how to, if by improving function of the knee, for example, just the tracking of the patella, for example, when that is improved, then there are changes which occur elsewhere in the body, which could be in the ankle, they could be in the hip, they could be in the opposite shoulder. And this book explains that. It explains why these things shift from one part of the body to the other. So that is a great book, and I recommend it in my workshop manual, and I recommend that people buy it from China Books.